Well, good afternoon, everybody. I just want to jump right in because obviously we're seeing the headlines all across the United States as it relates to an increase in case rates on COVID-19, transmission rates that have led to higher positivity rates in many, many states. In most cases now, we're seeing record number of cases and transmission in this country, and we're seeing states with transmission and positivity rates that put them in some cases in the high teens, 20, 30, some cases 40% positivity rates. Obviously, it's raised some alarm, raised some concern, and I want to jump in and give you the latest here in our state. As you can see, our case numbers have been trending up as well. The 7-day average of 5,889 number of tested positive for COVID-19. Yesterday, the number came in over 7,000, 7,212. That number was familiar 4 to 6 weeks ago, but since the early part of October, where we were able to get those numbers down below 3,000, we haven't seen an average of 7 days above 5,800 in quite some time. Let's take a look at the positivity rate. As you can see here, the positivity rate, again, the percentage of people that are tested and those that are tested positive, that positivity rate's at 3.7%. I should note just on October 19th, not too long ago, a little less than a month ago, when I made a presentation, the positivity rate over a 14-day period was at 2.5%. So 2.5%, October 19th, when we provided you this information, now at 3.7%. In the last 3+ weeks, we've started to see not just the average number of people testing positive go up, but also the positivity rate go up. And I'll remind you why I make that point and make that distinction. We are not ashamed of testing people, quite the contrary. We want to see more tests, and you're seeing in this slide 143,711 average number of tests that we have conducted on a daily basis. By the way, yesterday was just shy of 194,000 tests. So we're getting close to 200,000 tests. That would be close to a record number of tests. That is aided by this new state lab, Perkin-Elmer, that we announced just a week or so ago. That lab is just getting up, just a few thousand tests being conducted a day, now over 40,000 cumulatively since the lab opened. But that state lab will provide at peak upwards of 150,000 additional daily tests, additive to the existing protocols that are already in place in terms of testing availability. But nonetheless, we're seeing the average number of daily tests go up. And when you're testing at this level, we anticipate seeing more cases. But it's the positivity rate that we track with points of obvious concern. Percentage of people that are testing positive gives us a sense of what's really happening, background cases, number of what we saw surveillance cases as relates to what's happening in communities large and small all up and down the state. 3.7%, 14-day positivity rate in this state. Hospitalizations, not surprisingly, we've been tracking this. We have been previewing this as well for a number of weeks now as we started to see a rate of decline begin to mitigate. We started to see some stabilization in the hospitalizations. And a few weeks ago, we started to see some increases in total number of patients with COVID-19 in our hospital system. As you can see here, just over the last 14-day period, it's increased 28.6%. So that trend line continues up, and I'll give you a sense of what that means to total system capacity, represented here in this slide. It's 4% of our total healthcare system capacity. So I want to put that number in perspective. We can run with headlines on case rates, but I think the more important number is positivity rate. We can run with headlines as it relates to new cases that have entered into our healthcare system, but I think capacity is the area of focus for us, and capacity we have been building, and capacity we have been focused on. 4% of our entire healthcare system capacity now has COVID-19 patients. Let's take a look at ICUs in the state. Those are also tracking, not dissimilar to hospitalizations, back up. 27.3% increase in the total number of ICU admissions over a 14-day period. And let's take a look at what that means in terms of our critical care capacity throughout the state. It's about 11%. of the total number of ICU beds and those that are available in our system. We still have over 20,000 ventilators available, 20,390 in the state. These slides are familiar, and these slides are important, and these slides will become even more important as we move back indoors, as people begin to mix outside of their households, as we see these winter temperatures increase the likelihood of people coming into our system with respiratory issues, with related flu symptoms, this twindemic that we're all anticipating into the winter months. Obviously sobering, these numbers, but again, the total capacity that we built out, the ability to test being substantially greater than it was just even a few weeks ago, let alone a few months ago, and the ample inventory of over 500 million masks and other related PPE is significant. And that number of N95 masks, procedure masks, surgical masks is unprecedented in terms of our total storage and cash in our system. All of that, in addition to what the healthcare delivery system is providing directly for themselves, meaning what the hospitals are procuring directly, our state hospital support combined with ventilators, both in the state inventory and individual clinics, not just hospital primary care, and throughout the entire system is substantially greater than it was in the beginning of this pandemic. Just trying to give you an overview of how we prepared in anticipation for what we refer to in this state as the second wave, and it's been referred to as the third wave, simple semantics in other parts of the country. One of the most important things we focus on, and certainly all of you focus on, you look forward not to Mondays, but Tuesdays when Dr. Galley gives you an update on our tiered status. And remember, a number of weeks back, we came up with these 4 tiers: purple, the most restrictive tier, and the yellow tier, in addition to red and orange, the least restrictive. We have made tremendous progress since we began to socialize this new tiered status. I anticipate tomorrow, you'll hear from Dr. Galley, that we will see more restrictive tiering based upon case rates that have begun to increase. And look at places like Mono County, you look at Kings, Alpine, Shasta counties, you're starting to see an R effective rate growing, you're starting to see case rates growing. And so I anticipate, without previewing too much detail, and of course on Mondays, late afternoon, early evening, we get all of the data and work through differences of opinion in some cases, or just making sure that we're all aligned with local health officers in terms of just the veracity of the data and the transparency of it before we release that information. But tomorrow at noon, we'll get that information from Dr. Galley, but anticipate that we'll see some counties moving backwards, not forwards. And this is exactly why we designed the tier status the way we did. It was about being more and less restrictive, not based upon political whim, but based upon the data, based upon the epidemiology, based upon the facts on the ground, and again, based upon local conditions in the 58 counties throughout the state of California. So the tiered system is working as it was designed. More on that tomorrow, but you can get a sense here based on the current tiered status now with 48 counties that are out of the most restrictive tiers, and more progress made into the red and orange counties last week when Dr. Galley gave his last update. Speaking of updates, tomorrow is a very important day for, well, hundreds of millions of Americans, not a exaggeration at all to say quite literally hundreds of millions of Americans. The prospect in California v. Texas, Supreme Court will hear oral arguments to potentially strike down the Affordable Care Act. The current administration in Washington, D.C. is advocating that the Affordable Care Act be struck down. As a consequence, we in California are vulnerable to a decision, the adjudication of that case, which will be a number of months away, but 6.1 million Californians with pre-existing conditions could directly be impacted by that Supreme Court decision. You hear often numbers that connect to the national scene, but here we're breaking it down so you get a sense of what this means for you here in our state, the most populous state in our union. 6.1 million Californians have pre-existing conditions. And don't forget, it is very likely, as we wash through COVID-19, the pre-existing condition of COVID-19 transmissions related to the COVID or the coronavirus also can increase and add to that number. You're seeing prospects of people who have limits on higher premiums due to their age and gender, those being impacted by this decision. And of course, those of us with kids, particularly those of you with kids that are younger than age of 26, the impact obviously on the ability to keep those kids covered on the parents' plans is also a potential impact of this decision. Let's put it in monetary terms. Let's put it in numerical terms, in terms of just raw health care coverage. Our Medicaid system in the United States of America is referred to as Medi-Cal here in the state of California. We are looking at the prospects of losing $20 billion in federal funding related to the ACA, the Affordable Care Act, if it's struck down. 3.5 million Californians have been beneficiaries of the expansion of our Medi-Cal coverage pursuant to Obamacare and the ACA that also could be vulnerable to that decision. $7 billion in federal premium assistance also could be at play. So add those two numbers up, $27 billion is what's at stake. When you read about the oral arguments tomorrow, you hear this debate, you hear these national numbers. This is your numbers, people here in the state of California potentially losing $27 billion of federal supports that would be impacted by this decision. We also have 1.5 million people currently enrolled in Covered California. That's our health exchange run by Peter Lee, who I will introduce you to in just a moment, also potentially can lose their coverage if the Affordable Care Act is thrown out. These are jaw-dropping numbers. These are extraordinary times. Tomorrow's oral arguments are profoundly significant to each and every one of you watching. And I'll just remind you, there are many other things that the ACA covers, the donut hole, all related issues that impact you. If you don't think it impacts you because you're not on Medi-Cal, or it doesn't impact you because you're not on health exchange, I would encourage you to learn more about what the ACA does and does not do. And don't learn that from nightly cable. Take the time, actually learn a little bit more by investigating the impact, because at the end of the day, the entire system is connected to itself in one way, shape, or form. Old frame, many parts but one body. That's the healthcare system. And the impact of this unraveling in impacting you is profound. And so we, of course, the reason it's California v. Texas, have a very different point of view than the Trump administration, and we'll be expressing that during oral arguments tomorrow with representatives as well that advanced Obamacare with the incredible support of our own Speaker Nancy Pelosi. It simply would not and could not have happened without Speaker Pelosi's leadership as well. And having just had a conversation with her a few days ago on this subject, I can assure you this is top of mind in terms of her agenda, not just the oral arguments, but the what if and how we prepare for a what if scenario moving forward. Just something else I thought I'd bring up, talk about scenarios. We didn't wait around and look at the Affordable Care Act as a ceiling. We looked at it as a floor. We looked at it as an opportunity to architect something that no other state in America has done. And it's worth reminding people that there's no other state providing subsidies for middle-income families. These are folks earning 400% to 600% of federal poverty. At last count, those subsidies are over $500 a month. This is so often forgotten. It's rarely even referenced or mentioned, but we are providing, no other state in America, providing over $500, in fact, it's exactly $509 for middle-income families, subsidies on a monthly basis, first in the nation, to help subsidize the costs related to the Affordable Care Act. We also deepening subsidies for people earning less than 400% of federal poverty at about $21 a month. We're proud of that. And all of this, again, can be impacted if the ACA is thrown out. We're also going to hear from Peter in a moment, record low premium changes this year, despite all the vandalism by the current administration in Washington, D.C. Premiums this year are going up. I know you heard the word up, but hold on, 0.5%, 0.5, less than 1%. Record low premium increase because of the success and the efficacy of not only the ACA, but the extraordinary leadership here in the state of California, at Covered California, led by Peter Lee. We also have done things that no other state has done, and that's provide coverage to people regardless of their status. And you say, well, that's how dare we do that? Well, just consider you're paying for sick care on the back end through your premium. You either want to pay exponentially more in the emergency room or stabilize individuals by getting them a COVID test or getting them a flu shot and eventually a vaccine, which we'll talk about in a moment, for COVID, so we don't end up infecting other people and impacting the entire healthcare delivery system. We just believe in the principle of universal healthcare from an economic perspective, as well as from a moral and ethical perspective. And so we're just proud of that. I wanted to bring that back up to your attention and remind you some of the things that no other state is doing, that California is doing, because of our commitment, not just passive interest, but commitment to provide coverage for all Californians. So it's with that that I'm very proud to bring up Peter Lee, the head of executive director of Covered California. No one does it as well as he has, and I couldn't be more proud of his leadership. You shouldn't be, you should also be equally proud of his leadership, but I'll let him speak for himself and give you a little overview since he started and his history with the ACA and Covered California, how effective their team has been and what's at stake as it relates to this new open enrollment period that we're launching here today, and how you can participate and how we can encourage you to get others that are not enrolled to participate, to make sure we're covering more people and putting less pressure, not more pressure, in terms of premium increases across the spectrum to everybody else. With that, Peter Lee.
Governor Newsom, thank you so much for having me here. And I really can't tell you how proud I am to be here in a state like California. You look at the data that's before you. California, in the last 7 years, has reduced the rate of the uninsured more than any state in the nation, from almost 18% to less than 8%. Biggest reduction. And it's not been easy. And it's not just about Covered California. It's about leadership from Governor Newsom, from the legislature, that said, we're going to expand subsidies. We're going to hold the line on not allow health plans to sell crappy plans. Short-term plans, pardon, that's a technical term, is not sell plans that actually are bait and switch for consumers. California has done everything to protect the ACA and, as the governor noted, go beyond it. Last year, 2020, was the first year we had in place these new subsidies for middle-class Californians. Governor noted, middle-class Californians are still struggling with healthcare costs. They're getting over $500 a month. That's $6,000 a year to lower their healthcare costs, to make it more affordable. But what's happened? Things have worked pretty well in California, but we aren't done, and we aren't done by a long shot. I want to note that for all the great work we've done, if you look around California, there are still about 3.5 million uninsured. Now, the biggest number of them are undocumented individuals not eligible for financial support, generally. Our state, though, has said every person in California should have coverage. Every American should have coverage. We're down that path. But what we're doing right now in open enrollment is there's about 1.2 million Californians eligible for either Medi-Cal or Covered California. We're getting the word out. So I want to talk about what we're doing. These masks, I wore it coming in. Covered California is going to be sending out 4 million of these masks to people that are renewing their coverage, 1.5 million, and everyone that signs up during open enrollment. We've sent them out to every big city mayor. We sent them out to legislators. We sent them out to celebrities. But I want to tell you, these aren't just a mask. They're a mask with a message. Message twofold. Get covered, stay covered. Get covered for COVID. And you live and breathe this. We Californians have done the right thing on COVID. What's it mean as a person? It means you wear a mask. You wash your hands. You watch your distance. So get covered. But it also means get health insurance. If you have insurance, you're more apt to get tested. incredibly important. What stay covered mean? Wear your mask all the time, when you should. But also stay covered. If you have insurance, keep that insurance. Now is not the time to back off, and California's not doing that. And I want to note, we're talking a lot about COVID. Governor noted capacity. A pretty small percentage of our hospital beds are taken up with people with COVID. We're ready if more get COVID. But we got tens of thousands of people with cancer, diabetes, HIV. Get covered, stay covered, because you don't know what you're going to get sick with. California's going to have your back. We want to make sure we get the word out. Open enrollment, as the governor noted, we're launching it today. It was open a week ago, but this is the real launch. The thing to know, you can sign up now, coveredca.com. You'll have coverage January 1. We want to leave no one behind. The governor was brilliant in articulating the issue about the Affordable Care Act and the Supreme Court. It touches every single Californian. You got employer-based coverage, you think it's not about me? It's about you. What did the Affordable Care Act do? No lifetime limits, no annual limits. Preventive care, required coverage for people with employer-based coverage. The Supreme Court could, and I think incredibly unlikely, but could take that away. It touches every single Californian. Finally, I just note that we all know there was an election recently. President-elect Biden ran on responding well to COVID and building on the Affordable Care Act. There is no state like California that has done those two things. Leaned in to respond aggressively to the COVID pandemic and leaned in to have the Affordable Care Act work and make it better. We're doing this open enrollment period months, 45 days before new president takes office. I think the nation's going to be looking at California, what we're doing, what we can do to have the next administration truly follow in our footsteps of building on the ACA and making it better. So I want to thank the governor for having me here. I think I'm doing a handoff back to some fact points, which is where you can go, coveredca.com. Open enrollment is now. And when you come to our website, I want to do one other thing. These masks, we got some in Spanish, we got them in Korean, Chinese, Vietnamese. You go to our website, you can find local help, people that speak every one of those languages. They all speak insurance, and your help is going to be free, but your costs are going to be lowered dramatically. And we know it's all about affordability, and that's what we're trying to address here in California. So, Governor, I want to thank you so much for having me here today. If we have other questions, I'm happy to serve, but it's been your leadership in our legislature that's really given a pathway for millions of Californians to have coverage. Thank you.
So get covered, stayed covered. Encourage you to visit coveredcalifornia.com, coveredca.com to sign up for our program, and encourage you to let folks know. You may have family members, folks that you're close to that are anxious about their health care and their coverage, to just go on that site, learn more about what we offer and the subsidies that we're providing and the stability that we've created in the market as it relates to premium. Again, 0.5%, a record low premium increase this year, and again, cannot express enough my appreciation to Peter Lee and his team and the incredible work the folks over at Covered California. I also should just note in closing, in the conversation Peter and I were having just a moment ago, most states are ending their enrollment period basically just weeks after they begin their enrollment period. This enrollment period ends on January 31st of next year. Most will end their enrollment period on December 15th. Again, we believe in healthcare. We believe in coverage. We don't believe it rhetorically. We support the ACA. We support efforts to continue to build off it, reform it, and advance the cause of universal coverage, not only here in the state, but we're going to advocate for that all across the United States. But we are not in the business of vandalizing that effort, and that's why we're evangelizing the effort, promoting it, advocating the effort to expand coverage through the exchanges, and encourage you, if you wish, to do the same. With that, I want to just briefly bring up what is topical and certainly generating a lot of news stories today, including lighting up my cell phone. And that's the announcement Pfizer made. Certainly lit up your 401k as the markets have responded quite favorably to Pfizer's announcement. No one was surprised that Pfizer's efforts on vaccine. We've talked about them on multiple occasions here at our weekly press conferences. What I thought came as a particular good news was the 90% effectiveness that was announced by the CEO of Pfizer. Not necessarily the availability of the vaccine. We had anticipated its availability. We'll anticipate as well the approval of the FDA and the emergency authorization. We, of course, don't look just at the efficacy. 90% effective is very good. Better than some had projected, a low end of 50%, some had projected around 70%. But we're also going to look at the safety and the efficacy, and that's why we put together a number of weeks ago the Safety Advisory Committee that has already been meeting, as well as announced that other states in the West Coast of the United States are joining our efforts to review the efficacy of these vaccines. And I say vaccines because Pfizer's one of many that are working advanced development of vaccines. Pfizer generating headlines today. Others will generate headlines over the number of weeks ahead of us, perhaps months as well. I want, though, to caution, and that's the second bullet point you see in this slide. That's great news, but mass distribution is ways off. Why do I say that? I had one of my oldest high school friends that said, "What a great day," comma, and I don't just mean the outcome of the election. I mean, now we all can have dinner again. I can't wait to invite you to one of my Friday night dinners. And I had to immediately text back, say, maybe you were misled by the headlines related to this vaccine. This vaccine is not going to be readily available for mass distribution, not just Pfizer, but others, likely well into the next year. She paused, reflected on that, and that's why I want to bring it to your attention. I am concerned, truthfully, that we may get over-exuberant because now we believe we have a safe and effective vaccine that is available, and people may go back to their original form. That would be a terrible mistake. It is absolutely incumbent upon us to recognize two things. A vaccine is on the way. That's good news. But the availability to you and me and others outside our first responders, outside our healthcare professionals, is many, many months off. And let's just look forward to the reality of a second wave that is already taking shape all across the United States of America, where you're seeing record number of COVID transmissions, increase in ICUs and hospitalizations all across this country. Wear a mask. Continue to physically distance, socially distance. Do not take your guard down. The obvious question that will be asked, I imagine, later today in this press conference is, well, why do you think there's been an increase in cases here in the state of California? And it's for obvious reasons. People are letting their guard down. They're taking their masks off. They're starting to get together outside of their household cohorts. They're starting to see businesses reopen, and we're starting again to see more people mixing. As it gets colder, we'll see more still. So this was anticipated. No one is surprised by this. If you're even modest, cursory student of history, you'll look at the pandemic in 1918 and 1919. It wasn't just a one calendar year pandemic. And you'll note, similarly, a little spike in the early part of 18, a big spike, second wave, in the latter part of 18, and then another modest spike into 19. If this virus follows similar trends, we could anticipate something along those lines again. History may not repeat itself, but as they say, it rhymes. And so in this case, the one better news announcement is the vaccine that wasn't necessarily available around the globe in 1918, 1919. But now we do have that, but doesn't mean it's a substitute for you to say, well, we just go back to normal. Let's open everything back up. Let's all have everybody over for the holidays, and let's get Uncle Joe, who I know has a heart condition, let's get him back in with the grandkids because they haven't seen each other in a year. We've got to be careful. You've got to protect yourself and protect your loved ones. I can't impress upon you more what a mistake it would be to read these headlines and then walk away from all the extraordinary progress you and others have made to keep yourself and your loved ones safe. So please, please, let us double down on the work that we have done together on non-pharmaceutical interventions, meaning not therapeutics and not vaccines, that have mitigated the spread of this virus so effectively, disproportionately here in the state of California. You've done an exceptional job. Let's continue to do that hard work. And let me just remind you, on the vaccine itself, why I'm saying all this, because it's one thing to say it in abstract mass distribution, but I'll remind you of the vaccine plan that we put out just a few weeks ago. We talked about who gets the priority in terms of the first phase availability of a limited supply of vaccinations. And by the way, the Pfizer announcement today was about a limited supply of doses. These Pfizer vaccines require 2 shots, 2 doses, and it requires those doses to be dosed with 21-day phasing between each shot. It also requires, you may recall in one of the presentations we made, ultra cold storage. So there's a lot of technical challenges, a lot of distribution challenges. There are all kinds of transport media related challenges, not just the vaccine. And so we have our vaccine plan. We've been working, you recall, we were one of the first 5 jurisdictions in the United States working with the CDC, developing our vaccine plan, always anticipating Moderna and Pfizer as the first tranche of the vaccines. CDC thought they would see those vaccines made available in October. That didn't happen. They said, well, they'll be made available in November. That's unlikely to happen, but it does appear, at least with Pfizer, some limited number of vaccines will be available in December. But what about you and everybody else that's not on this list? Healthcare workers. You're not a healthcare worker. And by the way, depending on how you analyze it, there's anywhere from 1.5 to 2 million healthcare workers here in the state of California. So all of the vaccines that Pfizer just announced, just do the math and anticipate that we get, let's say, 12% of them. Each dose, you have to have dosed twice, cut the number in half, look at 12% of that. We won't even be able to cover all the healthcare workers in the state of California. So put this in perspective. It's not to take away one's enthusiasm. One should be enthusiastic about vaccines. And I certainly am. I'm not trying to take away any of that. I'm just trying to be honest with you and forthright around the importance of maintaining our vigilance through this very challenging time as we enter into the winter and cold months as well. Look at that. It's not just healthcare workers. We want to be there for our first responders. They're always there for us. Other high-risk groups, you may not be in this category, 65 and over at a skilled nursing facility or a residential care facility. You may not be someone with disabilities. You might not be in these higher risk groups that we have put out. That's the next tranche of prioritization. That's why we put together not only a scientific safety review work group to look at the efficacy of the distribution of the vaccine, which I mentioned a moment ago. And you can just see the biostatisticians that we put on there, the epidemiologists and pediatric infectious disease experts that are part of that safety group. But we also put this work group together. And this is the drafting guidelines work group. They have also met. And I'm very proud of this group in particular because this is the how. We know what the what is now. There are many different groups working to advance vaccines, Pfizer announcing what they're doing today. But the question of how do we prioritize the allocation with more nuance and specification than even the previous slides suggested. And that's why we brought ethicians on board. That's why we have geriatrics experts. And we brought others onto this guideline work group so that we can work with the administration, the current administration, and the next administration to get this right with equity as a lens by focusing on the most vulnerable and those in needs and not screw this thing up. Let's do this right. And so we're very proud of this drafting guidelines work group and our scientific safety work group. Again, we already identified them. By the way, one of our scientific safety work group members was just brought on board. We couldn't be more proud, Dr. Gusby from UCSF. He was just brought, they took him from our scientific safety work group, but now he's on President-elect Biden's working group as it relates to the coronavirus. So we are uniquely positioned in terms of those relationships, many others that are on Vice President, now President-elect Biden's committee, that are very close to the state of California. That will allow us hand in glove in terms of the efficacy and the safety concerns. But the guidelines that we need to advance to distribute and allocate and prioritize to the most vulnerable is equally important. And that's why I just want to remind you of the work that's ahead of us, but also the work that we're currently doing and the work we look forward to advancing with the current administration through their transition, because they'll be here through January 20th, and then the new administration. We want to be hand in glove with both administrations to get this right and to do justice to address the needs of each and every one of you. Just briefly, I know this may be a little too much information, but we'll close the presentation here in just a moment. Pfizer will be distributing their vaccines based upon the existing protocols. This could all change in hours, days, and weeks and months, but based upon the information that we've been provided here in the state of California, they'll be distributing through their existing network those first vaccines. We want to help influence with how and where those distributions are advanced. But they have a very well-established network, not surprisingly, with hospitals and pharmacies and clinics and the like. The next tranche of vaccines will likely go through a middleman, well known to people out here in the state of California, former headquartered company here in the state, McKesson, that will be the middleman on these other vaccines and their distribution channels. We've already been engaged with them, working with our work group, the drafting guidelines work group, to make sure that we are focusing on the needs of the most vulnerable and getting this right. And so just that gives you a sense of at least that's our working theory based upon the deep relationship that we've advanced with the CDC and with the DOD. Remember, the DOD is also part of this larger application and distribution network. But well-founded in this respect. In closing, remember, we distribute roughly 19 million flu shots a year. Been doing this for decades. We know how to distribute vaccines of all types. We have well-established networks, well-established protocols. We want to build on that, and we want to make sure, as it relates to the distribution of these vaccines, that we are mindful of what's working with the existing protocols and how we can build on them, and always mindful that supply constraints continue to be top of mind as it relates to concerns. I mentioned ultra cold storage. There's the Moderna cold storage that may not be as ultra cold, but all of these are vexing and challenging issues, and those are just two of what we hope will be many different manufacturers of vaccines, and how we need to accommodate for all of these different methodologies and these distribution strategies. So we're working all of the above, but just please remember, no substitute for wearing a face covering, no substitute for physically distancing, no substitute for getting a test, and now we're making it cheaper. You'll see it get down to 20% of the existing costs for taxpayers and for health plans and insurers, as well as individuals, because of our new state testing capacity, 150,000 at peak in our partnership with PerkinElmer, but also the isolation, the contact tracing, and the quarantine that's also got to be even more precise and more effective as we move through these winter months and start to see a mass distribution of these vaccines in April, May, June, July, August, September, October of next year. So that's an update. You can see here a summary of all of the above: wearing a mask, the physical distancing, the sanitation, and of course the mixing, which is so critical to consider and during the holidays, and obviously as the winter months present themselves more ferociously. So with that, I'm happy now, of course, to take any questions.
Jeremy White, Politico.
Hey, Governor, thanks for taking my question. I know you're not going to tell us who you're considering to fill Vice President-elect Harris's Senate seat, but I was hoping you could give us a sense of the timing. Is this something where we can expect an announcement from you in the next couple of weeks? Do you need to wait for Senator Harris to officially give up her Senate seat? I know a lot of people are curious about just the timeline on that.
Yeah, no, and I appreciate an understandable and appreciative question. Look, no timeline's been established. Process is just beginning to unfold. We just got word that the race was called by everyone but the current occupant of the White House. Obviously, we have to work through those issues and get to the point where we can make some determination. Obviously, I want that determination to be made on the basis of where Vice President-elect Senator Kamala Harris is vis-a-vis her own timelines and needs, and we'll work through that as we are working through the cattle call of considerations related to what's the profile, right choice to replace Senator Harris, and when is one part of that decision-making process, who is perhaps the more challenging part of that decision-making process. I want to make sure it's inclusive. I want to make sure that we are considerate of people's points of view, and we are in the middle of that as we speak. But I'll be honest once again, and I don't mean to deflect, but I just mean to be as transparent and forthright with you. My weekend was not focused on that. It was focused on seeing these case rate numbers go back up. And I'm concerned about that. 3.7% 14-day positivity rate may sound great compared to most other states right now. But again, we were at 2.5% on October 19th. And we're starting to see people, again, take down their guard, take off their masks, begin to mix outside their households. We're seeing some early indication related to Halloween. I'm very sober about that, and that's what I was elected to focus on first and foremost. We'll get to that important decision on the Senate, but right now that's our top priority, is addressing this issue.
Adam Beam, AP.
Thank you, Governor. For the first 2 years of your administration, California has had this reputation of being the leader of the so-called resistance to President Trump and his administration. What do you expect him to do between now and January 20th, and how might it impact California? And once Joe Biden takes office, how will the change affect California and the way you manage the state's relationship with the federal government?
Yeah, I mean, it goes from headwinds to tailwinds. And that's pretty obvious. Got over 100 lawsuits with the Trump administration. Trust me, we're already working aggressively, have been for a few weeks in anticipation of a transition to adjudicate, figuratively, not literally, the process and protocols around which lawsuits may be dropped, which lawsuits can be addressed by executive order, lawsuits can be addressed through agency determinations or administration walking away as it relates to their advocacy to disrupt the state of California's well-established autonomy under federalism or well-established case law as it relates to waivers that have been firmly established and codified over and over by administration after administration, court decision after court decision. So all that is being addressed. But here's the good news. Building better, stronger together, the theme, the framework that was advanced by the Biden-Harris administration, that's our agenda on early child care and focuses on early education, the broader issues related to their agenda on health and education, issues related to the environment, environmental stewardship, and low-carbon green growth. Broadly, those are California. That's a California agenda. In many ways, we say this all the time, future happens here first. We've established a lot of the efforts, and they've been established and advanced here in the state. They just want to begin to scale them. So this is an exciting and enlivening time and opportunity for the state of California, and we're going to do everything we can to maximize it and to do so very efficiently and effectively. And we are not waiting for President Trump to make an announcement saying he's walking away or work his way through the court system. We are working very collaboratively now and engaging all of our department heads, agency heads to advance and their agenda, our agenda, the collective agenda that is the state of California. And we're also working very closely with Speaker Pelosi on the critical importance of a new CARES Act, a new stimulus, and how that can directly benefit individuals, not just states and cities and the budgets related to states and cities, but also, more important than anything else, you, and how we can stimulate economic growth, economic recovery, private activity, and new consumer spending. That's a virtuous cycle that allows more people more opportunity. And so, again, very exciting time, and I can assure you it is nice to have a U.S. Senator from your home state as the Vice President-elect.
Capital Public Radio.
Hi, Governor. I'm just wondering if you have spoken with President-elect Biden or Vice President-elect Harris since the race was called on Saturday and what you talked about. And then another question, the state sent every voter a mail-in ballot this election, and we had highest turnout rate in decades. I think there are discussions about making that statewide vote by mail permanent. If that got to your desk next year, would you sign that?
Well, I'm not passive. As you know, I leaned in on the vote by mail. I've long been an advocate for more opportunity, for more participation in our democracy. Haven't been shy about that. So we would actively engage the legislature, and I certainly am open to pursuing that consideration. I've made that public statement before, even prior to Election Day, because it clearly has been well received, not just overwhelmingly utilized as a point of consideration as it relates to an alternative to in-person voting. I still believe in in-person voting for those that want choice and want those alternatives. But clearly, there's a trend here. You're seeing it all across the country this election, pre-2020, where more and more people are voting by mail, and more states like Utah and others have gone all vote by mail. So we'll discuss that with the legislature, and I look forward to that conversation with the Secretary of State as well, as we get a real post-election analysis of what went right, what went wrong. We'll learn a lot in that process and make a determination. As it relates to the conversations we've had with the President-elect, I haven't had the chance to talk directly to the President-elect, but we've been communicating the Vice President-elect, myself including, probably 45 minutes ago, and I look forward to following up with more and more conversations with both of them, but more importantly as well with their administration and their key leaders on the transition as it moves to the next few weeks and we move into that first 100 days of their administration.
Dustin Gardner, SF Chronicle.
Thank you, Governor. I was wondering if you could comment on the number of Californians on President-elect Biden's new task force. It looks like at least 3 of the 13 are from UCSF, so I was wondering if you could comment on that and also just speak more generally to his reliance on scientists and experts with this task force.
I mean, we talk in terms of abundance here in the state of California. It's a treasure trove of talent, human capital, birthplace of biotech and life sciences. We say all the time, more scientists, more researchers, more engineers, more Nobel laureates. We announced a number of them, highlighted them a few weeks ago, more venture capital, more patents emanating out of this state than any other state in America. It doesn't surprise any of us that UCSF would be front and center as it relates to the talent pool that Vice President Biden, now President-elect Joe Biden, would choose from. So we couldn't be more prideful and more proud of that extraordinary institution, UCSF, the UC system broadly, and all of the translational research that's being done, working with the private sector and the clusters of innovation, that entrepreneurial spirit that still is alive and well in the state of California. We just think it is an endless pool of talent, and I would be shocked if you do not hear more announcements over the coming weeks and months of other high-profile Californians getting picked to either advise or picked for formal roles in the new administration. Just to that point, you guys have highlighted a number of our key staff. 1 or 2 I don't want to lose, so I'm working hard to convince them not to submit their resume. I say that slightly tongue-in-cheek. I want to support whatever they choose, but we have some really talented people, and it's wonderful to see some of those people on the short list, potential short list, and appears that they might be for consideration in the new administration. That would be great for our state, but of course we'd hate to see some of these folks leaving our state as well, at least in their formal roles. But this is a testament to California, and as a fifth-generation Californian, I couldn't be more proud. I was out there yesterday, by the way, with my son, out there, the site where gold was discovered, quite literally, the rock formation where gold was discovered in California in 1848, trying to explain to my son Hunter how it all began here in this state, where there's just thousands of Californians, and now the talent that has come here for riches and new beginnings from all around the world, how we can never take that for granted, and how that is a point of distinction and deep reverential pride as Californian myself, born and raised, but also I think as it relates to our relationship to the rest of the world, not just this new administration.
Final question, John Woolfolk, Mercury News.
Hello, Governor.
Hey.
I was wondering if you have any idea from the contact tracing or anything about the source of the new infections. You mentioned people letting their guard down. Is that based on data from the contact tracing? Is that just a guess? Do you see any particular source or age group or or anything else that's driving the new cases statewide? Thank you, Governor.
No, I appreciate it. Good question. And I encourage people to go to our dashboard. You'll see the new transmission numbers as it relates to age cohorts, also always with an equity lens, looking at race, ethnicity broadly defined and specifically defined as well. We do have information that's come from health officers and the constant contact that we have, consistent contact with our own Department of Public Health and Human Service folks, as well as the local and county partnerships that we have. We're also getting information back from contact tracers related to Halloween and some of the mixing, the cohorting outside of the households that we're experiencing as the winter months are upon us and it gets colder and more people are moving back inside, and information coming back in some sectors within our economy as we reopen the economy based upon the movement through tiers. With that, though, as always, and it was the last question, so let's get it answered as it should by a professional. And let me bring up Dr. Galley, who could talk more substantively and specifically because it's a critical question, and I want to be able to answer it as effectively as we can. Dr. Galley?
Yes, Governor, and really this is the question, and we're working hard with our local public health leaders and partners on this. And the one thing I'll note is that as we've looked at these increased cases across various counties and communicating with public health leaders, asking them where are they seeing transmission, many of them list a variety of different entities. We've talked about essential workplaces. Some mention places of worship, others mention restaurants, others list a number of different sort of venues. But one of the consistent, I would say, of almost each county that's having increased transmission, they mention private household gatherings as a major source of spread. So we continue to look, and the governor appropriately identifies that as a place where our guard may have come down, but we have to put it right back up, that these masks, even with loved ones that we haven't seen in a while, are really important. And that sense that we're safe because we know someone, it's not the case with COVID. It really matters who's been in your stable sort of cohort, who you live with in that household that matters. So it's not a surprise that we see household gatherings as a major source of transmission. But at the same point, it's a place where we can make important inroads. Our own choices can really reduce that transmission there and help not just transmission rates to come down, but our entire economy to stay moving. And as we look forward to tomorrow and the tier assignments, and frankly, a look forward to potentially no counties moving forward, but some moving backwards, more restrictive tiers, in our tiering system. It is looking at these household gatherings as we go into colder weather, as we go into the holiday season, that we really want to work with all Californians to determine what are our approaches, what are our collective actions to keep transmission low as much as we can. So certainly other parts could answer that question, but that's a very important source of transmission as we've identified with our local partners.
I appreciate that, and we'll look forward to Dr. Galley's presentation tomorrow, as we all do on Tuesday, as it relates to movement between tiers. And want to also just pick up briefly just on what Dr. Galley says. It relates to moving into the winter months. We are also looking to change some of the messaging to address the areas where we're now seeing some contact trace, seeing information come back from contact tracers where we're starting to see transmission rates begin to increase. So we're going to be more precise, more prescriptive in terms of the messaging. Guidelines remind people, despite the fact that people suggested, and some frankly just knowingly misrepresented, that we put out guidelines for Thanksgiving. We haven't yet. We'll be putting out messaging. We'll be a little bit more specific on our messaging, less so on what we refer to often as guidelines, because we, again, are trying to be a little bit more sophisticated based upon real life conditions and the dynamics that we're anticipating, again, through these winter months. So thank you all for your time and attention. I appreciate Dr. Galley and Peter Lee being here as always. We look forward to catching up tomorrow on the tiered status and, of course, more later in the week. Continue to be vigilant, but please take seriously the new rates, the new positivity numbers. Take seriously how deadly this disease continues to be, averaging 44 deaths every single day in the state of California over a 7-day period. This disease continues to be deadly, and a vaccine will come, but it's not going to come soon enough. This remains the most important thing you can do to mitigate the spread and the transmission of coronavirus. Take care, everybody, and thank you.